Welcome to week 10 of LVN 110A, Pharmacology for Vocational Nursing 1. This audio lecture will cover over-the-counter drugs and herbal and dietary supplements. So let's get started. You know by now that OTC is the approved abbreviation for over-the-counter drugs. These are drugs that do not require a prescription. They are used for short-term treatment of common minor illnesses and symptom relief. There are over 300,000 over-the-counter drugs available in the United States. They're used for cough, cold symptom relief, acne, minor pain from things like arthritis or minor injuries, muscle aches, weight loss. The list goes on and on. More and more drugs are added to this list annually. For example, in the past, lidocaine patches were by prescription only, but now you can buy them in an over-the-counter 4% strength. This is one of the little caveats of over-the-counter medications in that they're often available still with a prescription, but in a different, usually stronger strength or in a different formulation. In 1972, there was an over-the-counter drug review that occurred, and this was to review the safety, the efficacy, and to establish appropriate labeling standards for over-the-counter drugs. This review also included reclassification of over 40 product ingredients from prescription to over-the-counter status. The drugs must meet very specific criteria in order to be reclassified. So in order for a drug to be reclassified from a prescription to over-the-counter, there must be some indications that the consumer must be able to easily diagnose the condition. They need to be able to also monitor themselves for the effectiveness of the drug. The benefit of correct usage then must outweigh the risk associated with that drug. So that's where we get into benefits versus risk and the safety profile. Drugs must have a favorable adverse event profile, meaning that there's not a lot of things that can go wrong that are really life-threatening. There has to be a limited amount of interaction with other drugs and a low potential for abuse. We don't allow drugs to be over the counter frequently that have a high potential for abuse. We also have to have a safety profile that includes a high therapeutic index. So the therapeutic index is that ratio of toxic dose to therapeutic dose, meaning that there must be a larger gap between those. You cannot have a small therapeutic index, meaning that a little bit would lead to an overdose. It must be a large, high therapeutic index. So there has to be some practicality for over-the-counter use, meaning that the drug must be easy to use and it must be easy for the consumer to monitor. This is an example of an over-the-counter label. You may know chlorphenamine as Allerest, Contact 12-Hour, Triamenic, A-arm allergy relief. The label begins with the active ingredients per unit. So for example, this is per tablet. In a liquid, it may be per milliliter or per 5 milliliters, depending on the medication. The label then must include information on the purpose or the use of the product and warnings that are listed in conditions that you absolutely should not use under any circumstances or for very specific circumstance, which this particular label actually doesn't have. Then after that, the warnings should list conditions in which you would ask a doctor before use or a provider. Warnings include side effects that may occur and activity limitations or restrictions that need to be taken when taking the medication. The label must include information for pregnant and breastfeeding women as well as children. It needs to indicate what to do in case of an overdose. The label then includes directions that are easy to understand, storage requirements, and last but not least, inactive ingredients. That's where we might look for things that are allergens for some people. Medications that you might recognize as over-the-counter drugs include ibuprofen, naproxen or Aleve, diphenhydramine, which is Benadryl, loratadine, Pepcid was famotidine, omeprazole, that's Prilosec. As I had noted earlier, often the strength or the formulation is different, and so the over-the-counter is different than a prescription sometimes in that matter. In recent years, we've seen Flonase and Xyzal Allergy 24 that were switched and reclassified from prescription to over-the-counter. So this process is pretty continuous, and you'll see more and more medications that will be classified from prescription to over-the-counter. Over-the-counter drugs, however, are not without risk. Some of the potential hazards are that they may postpone the effective treatment of more chronic disease states, because when some people take an over-the-counter, they relieve the symptoms, and so they don't address the root cause of the problem, and a chronic or a more serious condition can go untreated. I always think about the patient that's treating heartburn, right? They start with an occasional Tums, maybe after Thanksgiving dinner. Then Christmas, they've gone, oh, maybe they're taking it for a week, and then January, because of the holiday season. Then the end of January, they just start keeping a roll of Rolaids in their pocket or their purse, and the next thing you know, they're weak, they're anemic, and they end up with a bleeding ulcer. So when we complete our assessment and ask about over-the-counter drugs, it's important to ask how often and how long they have been taking the drug. So symptom treatment doesn't always treat the cause. Other potential hazards of over-the-counter drugs include toxicity. For example, the use of over-the-counter cough and cold medications in toddlers can cause oversedation and sometimes seizures or tachycardia. So these medications are not recommended for children under the age of 2, and the label will state this, or state under the direction of a healthcare provider or under direction of doctor. Hepatotoxicity is one example that can occur with acetaminophen or Tylenol, especially if you take extra doses. They're still drugs, and so we have to caution our patients the reminder that just because they are over the counter doesn't necessarily mean that they won't interact or that they will not interact with the prescription medication. Pseudoephedrine is an example of a medication with abuse potential. You probably recognize this as Sudafed. This is why it's monitored and must be dispensed by a pharmacist with a picture ID and a notation on how much and how often it was purchased by the consumer. Another medication that is abused sometimes are over-the-counter nasal sprays, because once the patient starts using the spray, they can develop a problem where the tissues then produce a rebound effect and the symptoms return even if the original condition is resolved. A third example is dextromethorphan. This is the ingredient in cough medicines, many cough medicines, not all of them, but it has a sedating effect. And so there have been instances where kids were going to local stores, purchasing it, drinking it to become intoxicated. In many places, those are now also being kept behind the counter and cannot be purchased by a minor. So I'm going to briefly touch on herbal and dietary supplements. We just covered nutritional supplements, but here we're talking about dietary supplements, those orally administered alternative medicines, maybe including our herbal supplements, things like plant components, barks, berries, roots, leaves, teas that we would make that are used for their medicinal qualities. So when we talk about herbal medicine, we're actually talking about using herbs to heal. Now, this is, if you know me well, is an area that I can go on and on about. Herbal medicines have been used for centuries, and they continue to be used. I expect that they will continue to be used, and they're even increasing in popularity as we see a shift to a more holistic approach and a more preventive medicine and wellness approach. Still, it is important for us to remember that they're drugs and assess them accordingly. So this is one area where patients may not reveal or may be reluctant to reveal what they're taking because of some of the stigmas or fear of being judged or made fun of. It is estimated that about 50% of Americans use some sort of herbs because of the therapeutic. We want to use them to treat or cure diseases. Sometimes we use them prophylactically for the long-term prevention of disease. An example of that would be our echinacea, right? We have people that use it in order to boost their immune system. Another one is vitamin C and zinc, or the emergency, right? The airborne that you would see before you go on an airplane. Those are all examples of consumers' use of herbs in treating or preventing or curing a condition. Many of the conditions that we have are treated with herbal medications. Some of the conditions include anxiety, cough, cold, depression, St. John's wort, right? Headache. There's a skull cap tea that's used for headaches. Insomnia, we use melatonin, or we maybe use chamomile tea. Ulcers, PMS, premenstrual syndrome, arthritis. One of our common uses of those is capsaicin. Also, you'll hear of a medication called Arnica montana. Constipation, we will have medications, herbal medications used for fever, infection, stress, and just generalized weakness. Some of the commonly used herbal products are aloe, feverfew, obviously for a fever, right? That's where it got its common name. Ginkgo biloba for memory. Golden seal, again, St. John's wort and valerian are both for depression. Echinacea for immune, as well as garlic and ginseng. Garlic is also a natural anticoagulant, as is ginseng. And then hawthorn. Saw palmetto has actually been researched and is found to reduce benign prostatic hypertrophy. We'll talk about that later in LVN 122. When we look at dietary and herbal supplements, and we remember there was in 1994 a Dietary Supplement Health and Education Act, the DSHEA. It's where they labeled herbal products as they consider them as dietary supplements. So because they're considered dietary supplements, no proof of efficacy or safety has been required. There are then no standards for quality control. They may claim to have an effect, but they don't have to promise a specific cure. So you will find labeling that is unique to these supplements and these herbal because of this. They don't want to get in trouble with saying that this necessarily is going to cure a particular disease or treat a particular condition. When we look at alternative and complementary medicine, now we've covered this in LVN 121, but remember that alternative is the use of other products, either herbal or other non-traditional remedies instead of, and complementary is the simultaneous use of both traditional and alternative medications. Some of our nursing implications are that we will be sure we obtain that medical history, that medication history, all types of medications, assessing the level of education and understanding of your patient, assessing for information specific to various products. If you don't know about a particular product, ask the patient. Most of the time they've done extensive research and they can tell you, or they will ideally have the label there. That can be maybe a copy made or the bottle secured so that the provider can see that. Assessing their system functions, especially renal, liver, and cardiac, because of these being herbal remedies, there often are not a lot of drug or food interaction, drug-food interactions. They're more often drug-drug interactions. Assess for conditions that are contraindications to them, like garlic and surgery. So because it's a natural anticoagulant, we don't want to have garlic tablets or garlic capsules being taken prior to surgery, things like that. Provide a thorough and individualized patient education and ensure that your patients recognize that manufacturers of herbal products and dietary supplements are not required to provide safety. They're not required to provide effectiveness information. Also, know your resources as a nurse. Your Davis Drug Guide, includes the monograph for many of the common herbal drugs. And if you've not accessed, they have a free online database that's included with your drug guide. You might want to check that out because there are even more drugs in the online database than could be placed into the printed book. Herbal products may not be safe for pregnant or breastfeeding women, infants, or children. So remind your patients that natural does not necessarily mean safe. Teach them to monitor themselves for any unusual or adverse reactions, as well as the therapeutic response. So that's it for herbal and over-the-counter and dietary supplements. You know how to reach me, and I'll see you soon.